An Australian Senate inquiry into ADHD and issues facing those with ADHD has handed in its report calling for an overhaul of how the country treats the condition. Here's what's going on. Over 1 million Australians have ADHD, and this latest and broad inquiry, published on Monday, has found that the cost of the current system is far too high on both the healthcare, education, and justice systems, as well as on employers. On a personal level, the report said that above and more importantly than this is the cost it takes people from a well-being and financial standpoint. The inquiry's report drew from 700 submissions and the evidence of 79 people over 3 days of public hearings across Australia. It found there was fragmented care, inconsistent prescribing, a stigma towards both ADHD and drugs, high costs, lack of coverage under Medicare and the PBS, lack of in-school support, as well as in correctional facilities and out-of-home care, and few services in rural, regional, and remote areas. It also said there were challenges for girls, women, gender diverse, and First Nations people in getting appropriate care. On Tuesday, Health Minister Mark Butler welcomed the findings and called on the government to better support those with ADHD. One of the biggest issues has been access to appropriate healthcare and support, something Butler said had lifelong impacts on both people with ADHD and their families, including on their self-esteem, health, relationships, education, employment, and financial situation. Butler said more could be done to remove barriers for people with ADHD so that they can receive the assessments, healthcare, and support that they need. The inquiry, which was chaired by Green Senator Janet Rice, recommended a better quality of care, a more affordable and accessible range of services, improved awareness and reduced stigma, and a more coordinated approach from the country's many government and healthcare bodies. A few of the recommendations included a government-created and funded national framework for ADHD, a government review of the Medicare benefits schedule with an aim to improve the accessibility of assessments, diagnosis and support, a government review of the pharmaceutical benefits scheme to ensure the safe and quality use of medications, as well as the introduction of uniform prescribing rules, a dedicated ADHD information portal, a neurodiversity affirming public health campaign to shift stigma, an improvement of how the National Disability Insurance Scheme informs people about how they can use the NDIS to access ADHD care, as well as ongoing support for disability advocacy organisations. Additionally, Green Senators Jordan Steele-John and Janet Rice called for the creation of a Minister for Disability Inclusion, but there does not appear to be government support for such a position at this time.